Dr. Jennea Wood. I practice primarily at the Olympia and Lacey location of the Tummy Temple. Occasionally I'll cover for one of the other doctors up in Seattle, but I'm mostly in Lacey. And I've been teaching classes for years now on all different health topics. And this is just such a common symptom that people struggle with, and there are some really simple things that can help a lot. So I love teaching this class and just offering some resources. So I'm curious how many people on the call read the article on what our stomach does for us through Marlene's. It's totally fine if you didn't. You can hit the raise hand thing if you did, or just speak up.
Or put something in the chat box if you'd like, any comments.
Yeah. So I'm gonna review a few of those things. So I was curious if people had already gotten that information. So I'm gonna start with a little bit of review of what heartburn is, what's actually happening in the body, what it looks like in different people. So in the process of heartburn, which, it's kind of overlapping terms, heartburn, acid reflux, GERD is kind of the medical term, gastroesophageal reflux disease. So all kind of talking about the same thing, where the contents of the stomach are, for some reasons that we'll get into, allowed to reflux upward into the esophagus, causing irritation and inflammation of the cells in the kind of the lower esophagus, not to mention that horrible burning sensation. So if this process is allowed to continue long term, it can even start to cause precancerous and then cancerous changes in the esophagus, which is just not designed to be constantly bathed in stomach acid. So it's definitely worth addressing for all of the reasons, to feel better, to not be bothered by this, and then also just for long-term health. So the symptoms can range from a burning sensation in the chest or throat, partially digested food actually kind of moving back up into the mouth, nausea, an acidic taste in the mouth, or a cough actually, and hoarseness can present or can be the symptom that presents for some people. So in conventional medicine, it's treated by using various medications to suppress stomach acid, either to suppress the production of it by the cells in the stomach that make acid, or by neutralizing it. So things like omeprazole, also known as Prilosec, esomeprazole or Nexium, pantoprazole or Protonix. And then there's a different category that work pretty similarly that include called H2 blockers, called ranitidine or Zantac, cimetidine or Tagamet. These are just the brand name and generic name, or famotidine or Pepcid. And so those are all blocking the function of the cells that produce stomach acid. And then alternatively, things like Tums are calcium carbonate, and that is neutralizing the acid once it's already there. So the problem with this approach to treatment is that using either of those types of medications covers up the symptoms, but it doesn't address the underlying issue. So you might not feel that burning sensation anymore because the acid levels in the stomach are just suppressed so low that the esophagus, they're still refluxing upward, the stomach contents, because the esophagus is hanging open, but the esophagus cells are just not bothered by it because it's not acidic anymore. So, but then if you try to stop taking the medication, it's just always going to come back because the underlying cause has not been addressed. So ends up becoming sort of a vicious cycle. And the truth is that proton pump inhibitor medications were never designed to be taken for more than 2 weeks. but people are routinely instructed to take them for years or even decades, and it's becoming really common for babies to be put on them for long periods of time as well. So then the question becomes, why is this harmful, and if so, why? And yes, it's a problem. It causes a variety of problems to keep the stomach acid suppressed for months or years at a time. So as a naturopathic doctor, I was trained to understand that the body has very good reasons for doing the things that it does. So I want to go over what are some of the reasons why we make stomach acid in the first place. It's definitely not accidental. So it serves a number of vital roles, including killing off bacteria in our food, starting the breakdown process of our food, especially protein, so things like meat. And one thing I'll notice, or one main symptom that people will notice when they have really low stomach acid, is that after eating meat, especially red meat or pork, they will just feel this heavy kind of brick sensation in their stomach. So like that upper digestive tract. The word stomach gets used to talk about the entire digestive system and belly sometimes, but I'm talking the true stomach organ is kind of right at the top near the solar plexus. And so there'll be this heavy sensation there and feeling like food just sits and doesn't really break down. So that's one thing you can look for. So the stomach acid starts the process of breaking down protein in our food. It also triggers the release of pepsin, which is an important enzyme that also continues the process of digesting protein. That the acid aids in the absorption of minerals like magnesium, sodium, and iron. And that was some of the things that I brought up in the article I wrote for Marlene's. And then those same cells that specialize in producing stomach acid in the stomach also produce this fancy little protein called intrinsic factor that we absolutely need to absorb vitamin B12. We just, without it, can't do it, can't absorb it. So then that starts to explain the types of problems that can crop up with long-term use of stomach acid suppressing medications, which includes increased risk of food poisoning, bloating and irritable bowel syndrome, and constipation from incomplete digestion of our food, especially proteins, malnutrition from poor protein digestion and reduced absorption of minerals, and then vitamin B12 deficiency. And so what that can look like symptom-wise is anemia or fatigue that can be in part due to anemia and iron deficiency, osteoporosis, so not being able to absorb your minerals long term, that starts to really affect bone health. Skin problems, including rosacea, is highly tied to low stomach acid. Slow or impaired wound or injury healing, again, due to nutrient deficiencies. Depression, brain fog, and poor memory, again, due to nutrient deficiencies. We need all those nutrients. And then particularly from B12 deficiency, and it takes years to get this deficient in B12. You'll start to notice numbness and tingling, oftentimes in the fingers and toes. And then with truly advanced B12 deficiency, it's actually a cause of a particular type of dementia. And sometimes that gets confused with Alzheimer's, but it can be treated with vitamin B12. So, it's not the cause of all types of dementia, but it's one very treatable cause. And really, hopefully, nobody should ever get to the point of B12 deficiency that it would cause that. So, what is actually causing the heartburn? In the majority of cases, it's something called lower esophageal sphincter dysfunction. So it's where, and actually I'm gonna show a diagram real quick through screen share to just show you what I'm talking about right now. Give me 1 second. Okay, so hopefully you can see in this image, at the very bottom of that long tube of the esophagus is the lower esophageal sphincter. So it's this little band of muscle that can contract and hold the bottom of the esophagus closed so that nothing from inside the stomach can reflux or travel back upwards into the esophagus. So there are a variety of reasons why this sphincter would start to act up. We'll talk about those. So then when that sphincter is not behaving, the stomach contents reflux upward into the esophagus, which is just not equipped to deal with it. This triggers your immune system to get upset because that acid is not supposed to be there. And it produces inflammation in the esophageal tissue, which causes that burning sensation. And then over time, the cells of the esophagus actually start to change to be more like stomach cells in order to withstand the constant assault of the acid, which they otherwise are not equipped to deal with. And however, that change, that cellular change can sometimes become precancerous and then cancerous. There is, just as a side note, in most cases, people do not actually have too much stomach acid as the reason for heartburn. That is the assumption in conventional medicine that the reason you have heartburn is too much stomach acid and therefore we need to suppress it. But that's actually not true in most cases. However, there's a small minority of cases where truly the person is producing way too much stomach acid, and that actually is the cause, but not in the vast majority of cases. Okay, I'll share it for a little bit longer. So this band at the bottom of the esophagus, the lower esophageal sphincter, AKA the LES, generally it's meant to stay contracted most of the time, preventing acid in the stomach from splashing upward to touch that sensitive tissue in the esophagus. The sphincter is meant to just open when you swallow to allow food or beverages to pass through and then close right back up again. But there are a number of reasons why that process starts to break down. The biggest one is that there's actually a chemical signal that reminds the sphincter to stay closed except during swallowing. And that signal is actually acidity in the stomach, and actually strong acid in the stomach. So ideally, our stomachs are meant to function at about a pH of 2, which is really, really acidic. And they're constantly manufacturing hydrochloric acid to do that. So when there's too little stomach acid present, that chemical signal telling that sphincter to stay closed is absent, and so it just hangs open instead. I'm going to stop the screen share now. It just gets kind of floppy and stays open most of the time. And when that happens, I'm talking like it is meant to be a pH of about 2, hydrochloric acid, very, very acidic. When it gets less acidic, it'll still be a pH of 3.5 to 5, somewhere in there, which is still the acidity of, it's still quite acidic. It's just not acidic enough to send that chemical signal to keep the LES closed. And it's also not acidic enough to digest our protein properly. but it is acidic enough to feel really crappy going up the esophagus. So it can still cause all those symptoms and make you feel like, oh, what's all this acid doing here? But actually, oftentimes, there's some degree of the opposite problem happening. Some other factors that affect the function of the lower esophageal sphincter are actually just kind of alignment. So a hiatal hernia is an issue where the very top of the stomach is actually shoved through this dome of muscle that is called the diaphragm. That is our main breathing muscle. It contracts downward to allow our lungs to expand. So there's a little hole in it, and the stomach sits below it, and the esophagus travels through the hole and then up to the mouth. So in a true hiatal hernia, the stomach can actually be, the top of the stomach can be jammed through that hole. And so that is a major alignment issue that can really, really predispose to heartburn. There's also a syndrome that we call hiatal hernia syndrome, where there isn't a true hernia, but the stomach is misaligned in a way, it's kind of jammed up against the top of the diaphragm and still is restricted in its movement. Our intestinal organs are meant to be able to like kind of slide around and move against each other and have some mobility. And so with hiatal hernia syndrome, that gets restricted, and that can also worsen heartburn. It can also make us feel anxious because it's sort of restricting the motion of the diaphragm, which is how we breathe. And when we don't feel like we can breathe properly, that makes us feel anxious. It can also contribute to this sort of like spare tire, like tight feeling around the midsection. And then another alignment factor, and one that actually can contribute to hiatal hernia or hiatal hernia syndrome, is constipation. When we get really, really constipated, there's just more room taken up by the intestines, and that puts upward pressure on all of the other organs. And so that can also worsen heartburn. And then other things that can do it include peppermint, which is a muscle relaxant and has a really effectively relaxes that lower esophageal sphincter. So that's why, you know, if you've ever read about foods to avoid with heartburn, peppermint is always on that list because it does that relaxing thing. It's actually great for kind of cramping and spasm in the lower intestines because it eases the cramping, but not so good for heartburn. And then we can have unique food intolerances that are just, you know, our own particular reactions to food that can also worsen heartburn. Any questions so far? It's a lot of information, I know. Okay. All right, so getting into solutions. So one of the first ones is avoiding those common heartburn triggers. And so, you know, this list is very common. A lot of times conventional doctors will also tell you to avoid spicy foods, coffee, chocolate, caffeine, greasy foods, cigarettes, alcohol, cannabis, and then peppermint, as we were talking about, and acidic foods like tomatoes and citrus, carbonated drinks because those bubbles travel upward and can assist in reflux. And things that I would add to that list, I would say yes, absolutely, while you are in the process of recovering from heartburn, those can all be major triggers. So yes, it's a good idea to stay away from those things, as well as refined carby foods like cookies, breads, pastas, pastries. And then an option is to do some testing to figure out what intolerances you have that are unique to you, things that you eat, and then your body tends to create inflammation in response to that. So that's something that we offer. Any of our naturopathic doctors at Tummy Temple can help you with that. And it is either a blood draw or we usually do it as a finger prick blood spot collection for and delayed hypersensitivity immune reaction to a bunch of different foods. And there are different panels that, the most basic one is 96 foods. So it covers kind of all the basic foods. So that can be very, very useful and really help to reduce heartburn. And then a super important factor is just paying attention to how you eat. Your body needs time to shift into digestion mode. And a lot of times, most of us are running around in a bit of a fight or flight situation. And when we're in that state, the body literally shuts down digestive processes. So you're not making stomach acid, you're not making saliva, you're not making digestive enzymes or bile, and then the motility, the little waves of peristalsis that actually move food through the intestines are not happening. And so we need to give our bodies a minute anyway to shift back into digestion mode and start doing all of those things again in order to properly digest our food. So slowing down a bit as much as you can, trying not to eat on the run, eating in the car, try to fully chew your food. It's pretty common to just like gulp it down almost whole. And that really puts us at a disadvantage for properly digesting food. So a couple things you can do are take 10 deep belly breaths before meals to just kind of help your body shift into that mode. Make sure you're sitting down while eating and take your time. Chew each bite fully. Try not to eat within 3 hours of bedtime. Not everybody, but a lot of people are especially prone to heartburn while lying down. And it's still, that sphincter, when it's working well, should stay closed and it just shouldn't be an issue. Once everything's working well and everything's healed up, oftentimes it's not an issue to lie down shortly after eating. But still, we tend to sleep better if we eat a couple hours before bedtime and fast, give ourselves a little while to digest. And then especially with recovering from heartburn, that can be a problem. And then try not to overeat. Try to slow down and stop when you're about 80% full, and that, overfilling the stomach can contribute to all of this. Another thing to consider is hormone balance. So when our hormones are off, that can actually affect our digestion. So progesterone can relax that lower esophageal sphincter. And so progesterone levels are very high during pregnancy. That's one of the reasons that pregnant women are more prone to heartburn. Another one is the upward pressure of the baby. So obviously we're not going to do anything to reduce progesterone during pregnancy, but non-pregnant women can develop hormone imbalances too. And so that's something to consider if you trend toward hormonal symptoms. Some symptoms of excess progesterone include feeling really weepy or especially emotional, breast tenderness, mood swings, waking up feeling groggy, feeling really bloated, and especially like bloated with water weight. So those are some things to consider. And then there are some great herbs that can help to just soothe and heal inflammation that has developed in the lower esophagus. So generally, these are herbs that have a slippery quality. So they kind of act like an internal Band-Aid or healing salve that you want to take them a couple times a day, ideally, in order to just get this constant kind of bathing, healing effect on that irritated, inflamed area. So a couple of those herbs include slippery elm, marshmallow root, and licorice, and then aloe vera. So we have a really great intestinal healing formula called IntestiHeal. And so for that one, would have people take like a tablespoon. You could start a little lower just to see how you do with it, but a tablespoon mixed in 6 ounces of water 3 times a day or as needed for heartburn. Aloe vera juice, you could drink a couple ounces as needed, or ideally, if you're kind of trying to heal things and recover, like at least 3 times a day. Or we have a licorice chew called Temple DGL that's especially good for travel and really, really helpful for heartburn. So that one you chew 1 to 2 tablets as needed for heartburn. And just anyone who is aware of issues in herbal medicine might know or have been told that licorice can raise your blood pressure. This form of licorice will not do that. And finally, I talked a little bit before about the factor of alignment of the stomach. So, there are several different types of true hiatal hernia, 2 main types. One of them actually can sometimes, quite frequently, be adjusted by a trained naturopathic doctor who's specifically trained in this type of adjustment and in what's called visceral manipulation. The other type of true hiatal hernia, so we're not talking about the syndrome that I described, but where the stomach is truly herniated or pushed upward through the hole in the diaphragm, that type cannot be adjusted manually. And usually if it's a big problem, it actually needs to be corrected surgically. But some types of true hiatal hernia can be adjusted manually by a trained physician. And then hiatal hernia syndrome can definitely be addressed using gentle abdominal adjustment. So I can't tell you how often I've seen this make a huge difference in just in general how people feel. There's kind of this more freedom of motion in the abdomen, and then it can really, really help with heartburn. So it's definitely worth getting some assistance with this aspect of recovering from heartburn. It takes about 15 minutes. It can be, a part of a visit for something else, or, a part of like broader treatment to address, kind of cover all the bases of treating heartburn.
That visceral manipulation also helps you feel like you can breathe better, because it's all about the diaphragm and that stomach being kind of shoved up under there. So it also helps you feel almost less anxious and more like you can take a deep breath. It's really fabulous.
Mm-hmm. Absolutely. And then we also have an offering up at the Seattle Tummy Temple called Chine Song, which is a wonderful specific type of abdominal massage that can also really help with these type of issues. And our wonderful practitioner, Mindy, up in Seattle, is the one who offers that. And then I talked earlier about how constipation can be this source of upward pressure on all of the other organs. So getting help with that, if you're not sure where to start, and colonics can really, really help to reduce that upward pressure, to just clear out old built up material. A lot of times I will just, like, if someone's having a lot of heartburn, before I get into some of the things I'm going to talk about next, like adding in more specific treatments for heartburn, I will just recommend a couple colonics to clear out kind of old built up material, and possibly the DGL, the licorice, and see how they do with that. And then we can always add more things or do the food intolerance testing if needed. But oftentimes just getting rid of backed up material in the colon can really rebalance everything. And then we're kind of going in the opposite direction of the conventional treatment approach, which is to suppress stomach acid. So I actually, for most people, again, not every single person, but for most people, I want them to produce more stomach acid. And so there's one caveat with that, though. I will always do an exam where I press around the area of the stomach to see if that area is really tender. And if it's really tender, I will not do an adjustment on it until that tenderness goes away, and B, will not start someone on any treatment to increase their stomach acid, because when that area, so you can press this area on yourself, it's right where the rib cage comes together. There's just that kind of soft spot just below the upside down V that the rib cage makes. If you press in there, it can feel weird. It can feel like pressure, but it shouldn't hurt. If it really hurts, that's a sign that you have something called gastritis, or in severe cases, sometimes people have developed a true stomach ulcer, but usually that will be even more intense. But gastritis means inflammation of the stomach lining. And if that is the case, then definitely want to start with the healing, soothing herbs and identifying food intolerances, as well as working on stress management, avoiding coffee and alcohol, and NSAID pain medications like aspirin, ibuprofen, etc. All of those things are really hard on the stomach and contribute to gastritis. And when someone has gastritis, your stomach is in part probably suppressing its own production of stomach acid to protect itself, because currently the whole stomach lining is upset and inflamed and can't handle holding a lot of stomach acid. Whereas normally our stomachs are totally built to be a container of highly acidic material. When they get inflamed, that doesn't work so well. So that's the important caveat. If there's pain with pressing in that spot, you don't want to start working on increasing stomach acid. If that's not the case, then we can start using herbs and foods to stimulate increased stomach acid production. So we actually have sour and bitter taste receptors, not only in our mouth, but also in the stomach. And when those get stimulated by eating sour or bitter tasting things, that will help to stimulate both saliva production, but also stomach acid production. So because it takes our bodies a little bit of time to start, to shift into digestion mode and to actually produce stomach acid, it's best to take one of these things or eat one of these things about 15 minutes before your meals, so that the whole process can happen. The other thing to note is that when people have been struggling with heartburn for a really long time and have been taking these acid blocking medications for a really long time, you want to go slow. It's probably worth working with a practitioner, because when you've been suppressing that stomach acid production for a long time, your stomach can actually start trying to get around it by growing more stomach acid producing cells. And so then when you go off of it, you can have rebound excess stomach acid production. And so there can be kind of a balancing out period. It's really helpful to have someone to work with through that type of process, to make sure everything else is kind of lined up and you've got all your bases covered to make it through what can sometimes be a bit of a process coming off of those types of medications. That
That's
said,
that's just showing you how much your stomach wants to produce acid because it needs it for all
Mhm.
of the things you mentioned earlier.
Absolutely. Yeah. Our bodies really try to find a way. They're very good at that. So things that you can take to bolster stomach acid production are bitters. So that is a concept that's been around forever and ever. So many cultures have bitters that they used in little aperitifs, little fancy drinks that you drink before your meal, or like added to beverages, like bitter herbs that are added to teas. So you can we have a formula called Temple Bitters, and that is our herbal digestive bitters formula. Just at a regular grocery store, you could find Swedish Bitters, which is a brand that's been around forever and ever. So this is a thing that has existed for a long time, and it's a convenient way to get in a bitter flavor, and then they're invariably made with herbs that have other benefits for digestion as well. So you would take, in the case of our Temple Bitters, a dropper full. Either you could do directly on the tongue, but because it's a tincture, it is in a base of alcohol, and so that can burn a little bit. So usually I recommend in a little bit of water, just like an ounce or two, and drink that down 15 minutes before eating. Another option would be sour flavors like lemon or apple cider vinegar. And so this could be like squeeze a quarter lemon in a small glass of water and drink that down, or an ounce of apple cider vinegar in a couple ounces of water. Apple cider vinegar, any of these, but apple cider vinegar straight it burns going down. So I recommend diluting it in a little bit of water. Definitely.
Also, just so you know, I'm going to put in the chat box a link to a collection that Dr. Wood put together of all the different supplements that she's been mentioning, like the Temple Bitters and the Intesti Soothe and things like that. And I just did want to mention too, how Dr. Wood said all these herbs do different things. The Temple Bitters also has herbs in there that help calm the nervous system. And as she was mentioning, when the nervous system is in that fight or flight, you stop making those digestive juices. So not only does it stimulate your own digestive juices, but it also helps calm that nervous system so that your body can produce them on their own when you're in that rest and digest state. But I will share that link for people to check it out.
Thank you, Heidi. And yeah, that is such an important factor. Being relaxed, and sometimes we need some additional help from herbs that calm the nerves down. You can also use apple cider vinegar or lemon juice as a salad dressing. So, and then another way to get bitters in is bitter greens. So one of the ways people for hundreds, thousands of years have been getting this effect for digestive support is through, starting a meal with a small bitter green salad with lemon or a dressing made with vinegar. So there are food-based ways to do this as well. I had a patient once who was just, not going to carry around a bottle of pills or a bottle of liquid, and it was just not convenient for her to do the lemon juice, apple cider vinegar, all of that. So she would dry her own orange peel and chew on a little piece of orange peel and just kept that in her purse. So that absolutely works as well. Orange peel is totally edible. Definitely use organic oranges, because otherwise the peel holds a lot of pesticides and herbicides. But that's a great way to get some of that same bitter effect. And then it is possible to even add in additional acid, stomach acid, in a supplement form. So again, you would never want to do this if it's painful or tender to touch in that central area right at the solar plexus, just below the rib margin. But as long as you don't have that, supplements that contain betaine hydrochloride can be used to add in some additional stomach acid, and sometimes that can be so helpful, especially because just naturally our bodies produce less stomach acid with age. And so, you know, sometimes the bitters are just not enough. Our bodies are not producing quite as much with time, and you can add in a little bit of extra to help things along. So we use a supplement either called Biogest that is more targeted just the stomach acid and I think a little bit of bile support, or Temple Total Digest, which also has digestive enzymes in there. So it sort of covers all the bases of supporting the digestive process and helping us break down our food more fully. And then because one of the reasons we get into the state of low stomach acid is nutrient deficiencies, while we're taking something like Temple Total Digest or one of those supplements to add more stomach acid, it can be really helpful to take a trace mineral supplement, take some calcium and magnesium. I generally don't recommend taking iron unless you're having someone like you've done testing to show that you're low, because iron can be more dangerous if overused or taken when it's not needed. But really using that time to bolster our nutrient status, a B complex can be really helpful as well, because we especially need zinc and vitamin B1 in order to manufacture our own stomach acid. And so there's this vicious cycle that gets set up where we don't have enough stomach acid and therefore we can't absorb our nutrients, and therefore we're deficient in the nutrients that allow us to make stomach acid. So using that time where we're doing some treatments to have better stomach acid to build up our nutrient stores is a really helpful thing to do. And then, you know, there are sometimes more complicated cases. Sometimes the lower esophageal sphincter needs some other support to regain function. And so our naturopathic doctors have other, you know, more complex treatments and can really customize a plan to you personally. So this, what I've talked about so far will take care of heartburn and resolve issues in the vast majority of cases. And then there are some other strategies to be tried if needed. So never hesitate to reach out. We're all of the Tummy Temple doctors would be happy to help if needed. And I think I have covered everything I wanted to cover today. So please let me know if you have any questions for me before we wrap things up. I will be sending out a follow-up email we're offering some discounts off of, if you want to try any of the particular products that we have in our online store, there's a coupon code for 20% off of your order. And then if you wanted to try a colonic or abdominal massage session, or work with one of our naturopathic doctors, any session booked in the next week, you can take $20 off of that. So yeah, let us know if we can offer any support. And last chance for questions. Any questions in the chat box? I don't think so.
I don't see any.
All right.
Well, thank you so much, Dr. Wood, and thank you, Heidi, and thank you everyone for being here. I know I took a lot of great notes, and I am really, really excited about, it blew my mind about the sour and bitter taste bud receptors in the gut. That just is so amazing.
Yeah, that's pretty cool how our bodies work. All right, well, thank you so much, Elizabeth, for hosting, and Marlene's for hosting. And I think we haven't quite worked out the class schedule for 2022, but we Are planning on
More.
continuing to do a class through Marlene's once a quarter. So look out for those. We keep kind of changing the topics. And yeah, thanks for coming.
Thank you.
Thank you, everyone. Take good care.
Bye.
Have a good
Bye.
night.